Hi, I'm Dr. Richard Sullivan, pain medicine specialist and the clinical director of the Ascend Pain Management Program. The following lecture series relates to the medical management of chronic pain, especially in regards to medications for chronic pain management. In this lecture series, we'll be covering the rationale for taking medications and the rationale for reducing medications as part of the pain management program. We'll be looking at the effects of medications in the medium to long duration, especially as it relates to things like tolerance or an increased need for medication, dependence or the onset of withdrawal when we reduce or cease medications, and on other side effects related to using medications for pain. We'll also be talking about some of the specific subclasses of medications used for pain, such as the opioid medications, non-steroidal medications, and the antiepileptics or neuropathic medications. So welcome along everyone to the medication discussion as part of the Ascend Pain Management Program. My name is Dr. Richard Sullivan. I'm a pain medicine specialist and I'm the medical director of the program. Today we're going to talk about medications and we're going to discuss a little bit about why you're prescribed pain medications, what you're trying to get out of your pain medications, and why we look at medication reduction as part and parcel of the pain management program. During this talk we're going to talk about the medications that you may or may not be on, the rationale for starting those medications, your expectations of what you expect to get from a medication that you're taking for your pain management, some of the side effects you may be experiencing from those medications, some of the additional medications that you may be taking for other reasons, other medical problems, or to help with the side effects of your pain medications. We'll talk around the aids that you may be using to help with pain, such as heat packs, ice packs, massage, relaxation, those sorts of strategies. And we'll also talk about how you may reduce the aids and the medications during the 6-week pain management program. So let's start with your expectations around the medications that you're taking for pain. Questions that people often ask themselves include, am I taking this as a cure for my condition, or am I taking this to afford myself some relief? What are the outcomes I'm looking for? Do I want a reduction in my pain? Do I want to eliminate my pain? Do I want to be able to achieve more in my day-to-day activities? Do I want to be able to sustain things like the duration of time I'm spending at work or time I'm spending with the family? The rationale, aims and outcomes of taking medication for pain should include things like, what am I normally able to do and what am I able to do when I take pain medications? What are the side effects that the medications give me and how do I handle those? And how do they affect how I react day to day and the activities that I can achieve? In addition to how you're performing and how you're functioning, you also need to look at how you're feeling in yourself. Do these medications allow you to improve your mood and feel better on a day-to-day basis? Or are they having a negative impact on that and making you feel overall worse? You have to look at the ways in which these medications are affecting other aspects of your life, such as how much you're able to work, how much you're able to do in your average day, whether you're able to sleep effectively with the medications, or whether you're sleeping excessively and have sedation as a significant side effect. For each of the medications that you may be taking, ask yourself these following questions. What's important to me in my life? Is it my level of pain on a moment-to-moment basis? Is it what I'm able to do in my average day? Is it how I'm interacting with the people around me, especially those people that I love in my family, my peers, my friends? What's important from a social perspective? Am I able to undertake the sporting activities that I want to do? What's important from a work perspective? Am I able to get myself to work and sustain myself at work during the day? What are things like in the evening and at night time? Can I sleep okay? If the answer to these questions is that the medication is helping and is improving, then that's a good medication for you and a good medication for long-term pain. Of course, it's important that the medication doesn't cause you significant side effects as well, and we'll get onto that in a little while. Every one of you has persistent pain or chronic pain. That's pain that's lasting beyond 3 months or beyond the time of expected tissue healing. How do you feel about that diagnosis? Do you accept the fact that your pain is likely to be with you in the long term? If you're looking for a cure for your pain, or you're expecting the pain to resolve spontaneously, are the medications assisting you with that, or are they inhibiting you in that regard? Are the medications making it more difficult for you to accept that the pain is likely to be with you in the longer term, and what we need to do is shift our focus on the pain so that it becomes less of a significant impact in terms of how you are and your quality of life? With each medication, again, you need to review what the benefits are to you and what the bad effects are to you, what the side effects are. Many pain medications have significant side effects. Some of these side effects will affect your gastrointestinal tract, they'll affect your bowel. You may be on medications to reduce nausea or to help you with bowel motion, such as laxatives. Other medications can upset or change the stomach lining, such as the non-steroidal medications, which can lead to inflammation of the stomach, gastritis, or even cause ulceration. You may be on medications to minimize the chances of this, such as the proton pump inhibitors. Some people get rash or itchiness from their pain medications and have to take antihistamines. These medications can in turn add to the sedative effects of the pain medications. Every time you reach and take a medication for pain, there may be thoughts that pass through your mind. Why am I taking this medication? Is it doing me any good? Is it causing me harm? How long will I be on this medication for? Will it lead to an end of my suffering? Is this as far as I'm able to go? Are there any other options for me? Am I going to be tied to these medications indefinitely? These can all culminate in feelings of depression and helplessness, which can similarly aggravate the experience of pain. And you can see that a vicious cycle can develop whereby the reliance on medications can actually be part and parcel of some of the problems that relate to chronic pain. Now, medications aren't the only thing that we use to help us when we're trying to deal with a very difficult situation, such as daily pain, pain persisting throughout our life. Often we'll look at other aids that may help us get through. Common ones include nicotine, smoking, cigarettes, caffeine in the form of coffee and other caffeinated drinks, alcohol, and other recreational drugs or drugs of misuse. The reasons for using these aids are many and varied. However, the commonality is that they can all potentially worsen the suffering associated with pain. Therefore, as part of the pain management program, we look around your use of other supportive tools and other supportive aids and discuss ways in which you may want to reduce those to facilitate your recovery. It's important at this point to point out that pain medications are there for a reason. Most of the medications that you will have come across or been put on to manage your pain are actually quite effective in management of pain, especially in the short term or acute pain. That's why most of these medications were developed, to treat short-term pain, pain after injury, pain after operations, those sorts of things. These medications have become used in the longer term for people who have persisting pain, often without the good, strong evidence that they actually make a difference in the long term. However, when you first start these medications, you may well notice a significant change in your pain and pain experience. You may have reduced pain levels, you may have improvement in your function and improvement in your quality of life, such as things like sleep and mood. One of the issues is that sometimes these benefits are not sustained. And so over time, you may find that the pain starts to move back to the baseline level with recurrent flares and a reduced capacity to undertake your usual activities in spite of maintaining that same level of medication. At that point, the medication has really lost its clinical use and its ability to make an improvement in your life. The temptation at that point is to increase the dosage or frequency of the medication, and often this is what happens. And so you can find yourself on an increased amount of medication or an increased number of medications to help manage your pain. Again, when the doses are changed or a new medication is introduced, you may well see an improvement in your pain in the first instance. But very frequently what we see is that pain again returns to that baseline level and function starts to reduce again back to where it was before the medication was introduced. Again, now you may find yourself on a moderate or high dose of medication or a significant number of medications without actually having that long-term benefit of improved pain levels or sustained improvement in your function. The other difficulty at this point is that if you try and introduce a reduction or even a cessation, and that is stopping one or more of those medications, almost invariably you'll notice an increase in your pain that may last for many weeks. This is a significant disincentive to stop medications or reduce medications. And so you can find yourself in this very difficult situation where you feel trapped and tied to the medications so that you don't see a significant aggravation in your pain. It's bad enough that you have this pain going on a daily basis with flares happening often unpredictably, but knowing that a reduction in your medication is almost assuredly going to aggravate the situation can be extremely disheartening. Your body will process the drug and remove it from your body, and you will no longer be exposed to the chemicals. It may take some time before your body readjusts to not having that medication around, but eventually you'll reset to your baseline level. What that means is that if you stop a medication, a pain medication, and you do experience adverse effects, withdrawal, which we'll talk about in a moment, or an increase in your pain, after a period of time, that will again settle back to baseline. It's more or less the same process as increasing the medications or starting new medications, but happening in reverse, where the body gets used to the new level of medication or the absence of medication. In situations where chronic pain exists without inflammation throughout the body, such as in rheumatoid arthritis or in some cancers, there is a lack of evidence to suggest that medications in the longer term are likely to lead to significant benefit. There is no one single treatment for chronic pain. There is no one medication that's universally effective. And medications that are effective at one time may not be effective in the medium or long term. A medication that's effective for you may not be effective for the person that's next to you, and vice versa. Of course, the side effects of medication can be problematic too. They can affect your thinking, your concentration, your ability to stay awake. These would be some of the more common side effects of the stronger pain medications, such as the opioids and the ones designed for treating nerve pain, like Lyrica, gabapentin, etc. When you're prescribed medications for pain, there's a set dosage and timing schedule. However, it can be very tempting to step outside of the schedule to see whether or not you can gain better advantage out of your pain medications. This, by definition, is actually misuse of medications. And although it may seem harsh, it is one of the significant problems with pain medications in the longer term. The reason behind this is that when the body is exposed to variable dosage and timing of medication outside of the way in which they were prescribed, problems such as tolerance and dependence, which we'll get onto shortly, can become more significant and more pronounced. And that means the medications can be less effective and side effects can be greater. How do you feel your medications contribute to your ability to improve what you can do on a day-to-day basis? Do you feel that with your medications you can do more? And do you feel that that improvement is sustainable? If you're at work, do you find that taking the medications helps or impedes your capacity at work? Perhaps it reduces your pain and allows you to do more at any one time. But perhaps the sedative effects of the medications make it harder to get up in the morning and harder to focus and concentrate at work. All of these things have to be taken into consideration and balanced to ensure that the right medication is being used in the right way at the right time. If we're going to look at reducing medications, what are we going to replace them with? If the medications are causing problems and harm, but also keeping your pain at a constant level, how are we going to reduce these and ensure that you don't succumb to the issues associated with aggravation of your pain? The answer is around you in the other aspects of the program. Using pacing strategies, using stretch, gentle exercise, using mindfulness training and desensitization, all of these skills and approaches have been shown in the evidence to be equally as effective as medication in the medium to long term. The main advantage with these approaches is that they don't have side effects. They can flare pain in the short term, as doing any sort of activity can. However, in the longer term, you're not going to get an accumulation of some chemical in your body, and you're not going to get damage to any organs as a consequence of using these strategies. So the approach is, as we wind down medication in the program and following the program, that you replace utilization of medication with these self-help strategies. The first is that there is no medication that is completely safe. They can all have potential side effects, and sometimes we can lose sight of exactly what the effect the medication has upon us. Many of the pain medications affect the way we think and the way we act and our energy levels. And it's not until we reduce the medication that we actually realise to what extent it was affecting us. Quite often, patients come back after reducing some of their medications in and after program and say it's like waking up from a hazy dream. There's also the issue of the long-term health effects of medications. One example are the opioid medications. These include things like morphine, oxycodone, tramadol, and the like. These medications can have effect on our hormonal systems. They can upset our water balance and lead to fluid retention. They can reduce bone mineralization and leave us prone to developing fractures. They can affect our immunity and make us at risk of developing infections and even developing cancers. So you see that there are a range of effects that these medications can have that we can be completely unaware of. And by reducing medications or ceasing medications and replacing them with other strategies, we can avoid some of these issues. Medications fit broadly into a group of management strategies that we call passive strategies. Passive strategies are where we get someone else to help take care of us and our pain and our situation, or where we use something to take care of our pain and the effect that the pain has on us, rather than looking inside ourselves and using our own strategies for managing pain. The issue with passive strategies is that they don't allow us to shift from our position of impairment. They can keep us trapped in this cycle of dependence where we find it very hard to break out and make some meaningful change in our life. What's the best way to reduce medication? Do we take the pill packets and flush them down the toilet? Do we take our scripts and rip them up and throw them out? Or do we take a different approach? Because most medications will be associated with a change in the way we feel inside ourselves when we reduce and stop them, the best approach is to take it slowly and do it step by step in the supervised environment of the program. Some patients will elect to do their own reduction, cease the medications themselves. This is a hard road, but some patients are quite able to do this, and that's fine as long as you accept that there may be some side effect as a consequence. The approach we take in the program to medication reduction is to do it in a slow and tapered fashion. The idea behind this is it gives you a chance to readjust to your reduced medication level in the supported environment of the pain program. This will allow you to observe what changes you're seeing in your body and in yourself as you reduce your medications over that period of time. You're likely to see an increase in your pain as a consequence. This doesn't have to be synonymous with a reduction in your capacity to function or to undertake the other activities of the program. You can certainly offset this pain increase by utilising the other strategies of pain management that you're picking up. This will allow you to taper off medication at a time that you're increasing your other strategies for pain management. And you'll see that over the course of the weeks, the negative effects of the medications will lessen and the aggravation of pain that you may experience as you reduce medication falls away also, so that by the time you're at the end of the program, you're on less medication, feeling better and doing more. Many patients who come into the pain management program will be on medications to help them with their mood. They may include mood stabilizers, antidepressants, and medications for anxiety. In general, these medications won't be adjusted during the course of the program. The reason behind this is that these medications were specifically prescribed to help you with issues that may not relate directly to what we're addressing in the program. As such, your antidepressant medication and to some extent medications for anxiety will be left as they are. Certainly other medications taken for other health problems won't be adjusted during the program. In summary, what we're trying to achieve with medication reduction in the program is to let you take control of what's happening with your pain management, especially in regards to the things that you're putting into your body to assist with this. This will improve your capacity to self-manage your pain, reduce the side effects from those medications, and give you a sense of freedom.